Hi, it's Dr. Elisha Van Dusen here with New Hope Chiropractic. Should playing a musical instrument and practicing it create wrist pain, tingling, numbness, type sensations in the wrist? Well, carpal tunnel syndrome, or CTS, is a condition caused when pressure is applied to the median nerve as it passes through your wrist. And when playing a musical instrument, especially for hours and hours at a time, then these fast repetitive movements of the fingers can cause the tendons, all 9 of them, that travel through the carpal tunnel to rub together, creating friction. And this happens again after repetitive practicing for several days in a row. So this can lead to heat and eventually swelling or inflammation, and this can manifest itself as pain, numbness, and also tingling. And without treatment or modifications to your practice schedule, it's likely that the numbness and tingling in your hands and fingers will gradually worsen and may even completely prohibit you from playing your instrument as it gets really, really bad. So we have to accept that every tissue in our bodies has a certain capacity or threshold, and if it's exceeded, problems will surface, and there are factors that can make some of us more susceptible to CTS. Some of these differences include female gender, age over 50, hormone imbalances like low thyroid function, diabetes, and others, birth control, pill usage, pregnancy, obesity, and also manual intensive jobs. These all create a greater predisposition to CTS. So personality can even play a role. If you're someone who pushes yourself to play through the pain, then your risk of CTS is even greater. Because both hands are typically required to play a musical instrument, it's more common than not that both hands can eventually become symptomatic with carpal tunnel if you don't practice some very simple preventative measures and tricks of the trade. So what are those tricks? Well, you should take 30 to second mini breaks every hour during your practice sessions to stretch. So simply bend your wrist and fingers back as far as you can with your other hand or against a wall with the fingers pointing downward, and then try to touch your palm to the wall. Hold the maximum stretch for 5 to 10 seconds and then repeat that until the forearm feels looser. Usually 3 to 4 times will do it and give you some relief. Another trick is to wear a cock-up wrist splint at night, since we can't control our wrist or hand position when sleeping. And then when the wrist is bent to its maximum, the normal pressure inside the carpal tunnel increases 6 times or more, and this can really irritate the median nerve. So one of these splints will keep the wrist straight so it's not prone to bending at a very strong angle. So I, as a doctor of chiropractic, can teach you proper exercises. I can fit you with a wrist splint and also check to make sure the pressure in the median nerve isn't the result of dysfunction in other anatomical areas along the course of the nerve, like the neck, for example. So check us out at newhopechiropractic.com, and we're always available for a complimentary consultation to see if chiropractic is right for you. And in the meantime, have a healthy day.